Dr. Ken Landau, thanks for watching. Let's talk about Flexeril. It's also called Cyclobenzaprine. This drug is a muscle relaxant that was first approved by the Food and Drug Administration in 1977. If you have low back pain, chances are about 1 in 5 you're going to get a prescription for this medicine. The medicine remains in the top 50 prescription medicines here in the United States. It's not a controlled substance, it's not an opioid, it's not addictive. It's for skeletal muscle spasm that's associated with an acute musculoskeletal condition. The maximum course you should take it is about 2 or 3 weeks. Then you should get off of it. You could take it 5 milligrams 3 times a day. If necessary, it could be increased to 10 milligrams 3 times a day, 30 milligrams a day maximum. And it now comes in an extended release pill. It's a horribly expensive pill that we'll talk about later called Amrix. It could be taken 15 milligram once a day or 30 milligram twice a day. Now, most people who have back spasm, muscle spasm, take the Flexeril as an adjunct to some other kind of medicine. So you're already receiving maybe a non-steroidal anti-inflammatory drug like Naproxen or ibuprofen, or maybe receiving an opioid, or maybe benzodiazepine drug like Valium or Xanax. Though back pain obviously is extraordinarily common, it accounts for about 2.5% of all emergency room visits, about 2.5 million visits to ERs every year, and you can imagine the number of visits to family doctors, chiropractors, and orthopedists in addition. Pain outcomes, if you have low back pain, are generally pretty poor. You have to be careful if you're going to take Flexeril, if you're taking any other kind of central nervous system depressant, because it may be additive. If you take alcohol, a benzodiazepine, a drug like Xanax, or if you're taking an opioid, or a drug like phenobarbital or serotonin. Non-medical use, people tend not to abuse the drug, at least as far as recreational use. Occasionally it's used to increase a sense of euphoria or relaxation, especially in combination with either cocaine or methamphetamine. And it's been implicated in about 10,000 emergency room visits, but the exact role it plays is undetermined. Well, who should receive the drug? Maybe people who have a specific tender spot or tender point where you can push on the muscle and it hurts. Or maybe it should be used in people who, for one reason or another, can't take an NSAID, a drug like aspirin or Naproxen or ibuprofen, maybe because they have a kidney issue, or maybe because they have a gastrointestinal issue. As a treatment for pain, it's for acute injury. It seems to work best, if it's going to work, for low back pain or fibromyalgia. It doesn't seem to work very good for neck pain or myofascial pain. It reduces the pain, if it's going to do that, in the first several days that you take it. There's no evidence that it's useful for more than 2 to 3 weeks, because the spasm from acute injury generally subsides by then. It is not a chronic treatment, in spite of the way people seem to take the drug. An interesting study was done at the Montefiore Bronx Hospital in New York. They looked at people who came to the emergency room from non-traumatic, non-radicular low back pain. These people had high scores on the Roland Morris Disability Questionnaire, so they were hurting pretty much. So the patients were all given Naproxen, 500 milligrams a couple times a day. Everybody got that. And then they additionally received either a placebo, the Flexeril, or hydrocodone. And you know something? When they were reevaluated, there was no difference between the people receiving the Naproxen and the placebo versus the Naproxen and the Flexeril, or the Cyclobenzaprine, or those receiving the Naproxen and the hydrocodone. They all were the same. So 2/3 of the patients reported that they would actually like to receive the same medication again, whatever the combination happened to be, because they thought that it was pretty good. So if they ever had back pain again, they would take it. But at 1 week, 70% of the people still had persistent back pain and functional impairment. 70% were still using an analgesic, and at 3 months, 50% of them still complained of persistent back pain and functional impairment, and they were taking pills. Well, cyclobenzaprine, or Flexeril, is related to a group of drugs that are known as the cyclical antidepressants. That's right, cyclical antidepressants. The master of the family are the tricyclic antidepressants. They were originally described in 1889. That's the class with amitriptyline and imipramine. And then we have the drugs in the same family used for muscle spasm, the related drugs. So neck pain, they're not very useful, as I say, for myofascial pain. Insufficient evidence, don't seem to be useful. Fibromyalgia, it's not more effective than amitriptyline, but it does have more side effects. And for low back pain, it's as effective as just simply taking an NSAID like ibuprofen or Naproxen. The mechanism of action is pretty much similar to tricyclic antidepressants, drugs like amitriptyline. It reduces or abolishes the skeletal muscle hyperactivity, supposedly by interfering with the skeletal muscle activity, thought to be in the brainstem, not at the spinal cord level. The bioavailability, if you take the pill, is only about 30–35%. It tends to accumulate over a period of about 3 days. So to get a steady level in your bloodstream, you have to be on the drug for about 3 or 4 days. The half-life is long. It's about 18 hours, but could range up to 37 hours. If you have mild liver impairment, you could take the drug, but not if you have moderate to severe liver disease. You ought to avoid this pill, because it'll cause an increase in the concentration inside the system because it's metabolized in the liver. Well, if you're pregnant, it really hasn't been studied, and if you're breastfeeding, we know that the tricyclic antidepressants are going to be excreted into the milk. Flexeril is closely related, but there are no specific studies, not studied in children. Side effects are aplenty. Side effects include abdominal pain, could slow the intestines down. You could develop an ileus, could develop nausea or constipation, diarrhea. Then it can lead to irritability and decreased mental acuity, could raise the liver function test, injure the liver, cause drowsiness in about 40% of the people, same as taking a Valium, cause dry mouth in about 1/4 of the people, dizziness in about 1 person in 10, but more importantly, it can increase the heart rate, cause abnormal cardiac rhythms, cause an abnormal electrocardiogram, blurred vision, dilated pupils, anxiety, can lead to abnormal thinking or hallucinations or psychosis, can lead to difficulty swallowing, and interestingly, it can lead to painful ejaculation or pain after a person has an orgasm. Interesting, but that's one of the things that Flexeril is known for. Well, other side effects, especially in the elderly people, it's very common to cause agitation, confusion, delirium, cause cognitive impairment. And as a matter of fact, there's something known as the Beers criteria. Now, the Beers criteria are drugs that are inappropriate for people over age 65, and Flexeril is on the list. There's a strong recommendation to avoid this medication. And if you happen to be over 75 and you happen to be taking it, which you probably shouldn't do, then the concentration, especially in men, is going to more than double. And it has an atropine-like side effect. So that means if you're older and if you're a man, it can cause urinary retention. For people who have a narrow angle, it can cause a flare of angle closure glaucoma, increase the pressure inside the eye. You've got to be careful, especially if you're taking an anticholinergic medicine. Anticholinergic medicine would be Benadryl. And then it could lead to the Serotonin Syndrome. The Serotonin Syndrome is a horrible condition. Can get it by itself, or because you're taking a combination of a Flexeril with an antidepressant, a drug like Prozac or Zoloft, the SSRI or the SNRI. Could get it because you're taking a tricyclic antidepressant like imipramine or amitriptyline or tramadol or You're taking verapamil, or maybe you're taking a drug for migraine headaches, acute treatment of migraine headaches, or maybe you're taking an MAO inhibitor. All of those can lead to the serotonin syndrome. Serotonin syndrome with mental status changes, confusion and agitation, hallucination, autonomic instability and sweating, tachycardia, fast heart rate, labile, blood pressure goes up, goes down, cause a problem with temperature regulation, leads to tremor and ataxia, hyperreflexia, muscle rigidity, and then, of course, throw in a little nausea, vomiting, and diarrhea. Well, you have to be careful if you're taking this drug and you're taking another central nervous system depressant. This drug might be dangerous combined with alcohol, the opioids, the benzodiazepines, the phenothiazines that are now increasingly being used for people who have depression or people who have anxiety, people who even can't sleep, or people who have other kind of emotional disorders, or the barbiturates. And some surgeons request that the drug be discontinued prior to surgery because of the potential problem with heart rate. Now, this drug, if you combine it with tramadol, might lead to an increase in the incidence of seizures. You shouldn't take it if you're hyperthyroid. Shouldn't take it in the immediate aftermath of a heart attack or an arrhythmia, if you have a heart block, or if you have a condition known as QT prolongation. That's an abnormality that we find relatively frequently on an electrocardiogram. And you shouldn't take it within 2 weeks of taking an MAO inhibitor, a drug for depression. If you overdose on the medicine, it can cause significant issues, especially if you combine it with alcohol or an opioid or a barbiturate or a benzodiazepine. If you overdose on the medicine, it leads to a variety of situations ranging from nausea and vomiting and drowsiness to an increase in the heart rate, abnormal heart rate, decrease in your blood pressure, tremor, agitation, hypertension, slurred speech and cough and hallucinations and seizures and coma and cardiac arrest. It's rarely life-threatening unless it's combined with some of those medicines that I mentioned a moment ago. Now, if you stop taking the Flexeril, you could have a withdrawal syndrome, but the withdrawal syndrome is only going to typically last for a day or two with headache and some nausea, maybe some generalized malaise. It's in the same family as soma and scalaxin and robaxin and a variety of others, none of which are superior to each other. They all work about the same, and the same is maybe giving them credit a little bit better than a placebo. But as we've talked about, if you're already taking the Naproxen, it doesn't seem like Flexeril offers any added benefit, and the studies that have suggested it's beneficial are generally poor and incomplete. There's poor compliance, and there's inadequate randomization, and there's drug company money involved. The effectiveness is about the same thing as taking an amitriptyline or an imipramine. Obviously, there's the potential for other kind of side effects. So the question is the drug worth it? Well, that's an issue, and I'm not sure it really has a place in the top 50 medicines that we prescribe here in the United States. How much does it cost? Well, if you're going to take 10 milligrams 3 times a day, that means you need 90 pills a month, and if you went over to Costco and plunked down cash, it would be $16. CVS, it's $62. Vaughn's, $79, but if you have a coupon that you can get at goodrx.com, it's only going to cost you about $10. Now, I mentioned the long-acting or the extended release form that's made by Teva, and it's called Amryx. Now, we just said you could buy a month worth for $10, and it requires you to take 3 pills a day. But with this one, with the Amryx made by Teva, it costs, the list price is $1,400 or $1,418 actually. But they give you a coupon so you could get it for $1,100. So remember, with Flexeril, it's a very commonly used drug for people who have acute muscle spasm. People tend to take it for a long time, but it's probably not valuable after 2 or 3 weeks. So we have a drug that probably isn't much better than a placebo, if it is better than the placebo, but it does have significant potential for side effects. So if someone's going to give you a prescription for this, you might want to ask why. You might want to go and consider something else. Anyway, thanks for watching. I'm Dr. Ken Landau.